The mission of MSDE is to drive the standards for professionals to promote healthy living through self-management of diabetes and related conditions.
The role of a diabetes educator is to use two aspects, science and art, to help the patient who has diabetes understand what the condition is and what they can do to make a difference in how well their diabetes is controlled.
Good diabetes care is all about team care. The person with diabetes and a critical member of that team is a diabetes educator. They play such a vital role of that link in communication and support that we just couldn't do without them, and they're essential to good diabetes care.
We are there to facilitate their changes. They are going to make the change. We are obviously not going to, but we are going to help them with knowledge, with enthusiasm, with encouragement. That is powerful tools when people make changes.
Education is paramount because they are the ones that give us the knowledge on how to cope with the disease.
The role of a diabetes educator is like a coach. And we're not there to provide knowledge, but to help patients change their behavior to better manage their diabetes.
I think often of diabetes educators as playing a behind-the-scenes role, or maybe a member of the stage crew, and look at their patients or people with diabetes as being actors. So they work behind the scenes to help us stay healthy, motivated, educated, and it's just really nice and comforting to know that they are always a part of our team.
I just am so proud of all that our organization does and what expertise we have within it.
The Minneapolis St. Paul Diabetes Educators has been just a phenomenal partner with the ADA over the years, especially in terms of our advocacy efforts. We could not have passed insurance reform during the mid-90s, become really the second state in the nation to do it, if it hadn't have been for our strong partnership with MSDE.
Awareness is really important. When I started looking at actual prevalence numbers back about 10 years ago, only about 1 of 2 people that had diabetes knew it. Now that number is down to only 1 in about 4. So we've come a long way. We know that the earlier someone that has diabetes is diagnosed and treated, the better their chances of living healthy.
I think for our organization, we should be proud because I think we really collaborate well together. We're from all different health systems. We treat all different people with diabetes or with pre-diabetes, yet we come together as a group and support one another so that we're at our best to provide that information for people.
This gala award is a wonderful way to recognize the people that are behind the scenes. There's so many people that are involved in diabetes care and have such positive influence, and so I'm delighted that we're able to recognize the people that are behind the scenes tonight.
Without the education, I'd be lost, and not only do they give me the tools I need to live my life on a daily basis without diabetes controlling it, but have also allowed me to embrace the condition and grow from it.